Hi Kardium team, my name is Brooke Ernest and I was the lead clinical research coordinator on the Kardium Pulsar study at Sutter Health in San Francisco, working alongside Dr. Woods. Since joining Sutter, I've worked exclusively on electrophysiology studies and I absolutely love this field. Your team may remember Kenny Wong, who was an incredible mentor of mine and an integral part of this study in the early stages, and his guidance has had a lasting impact on how I've grown in this role. It's a really exciting time for EP right now, with multi-site studies happening all across Sutter hospitals in the Bay Area and even Sacramento. And our One Sutter model has really fostered meaningful collaboration among all the EP physicians as they work together to expand access to these studies and really advance patient care. At Sutter Health, we hold ourselves to a very high standard, and investigators here are expected to enroll a patient within 90 days of study activation, and if they don't, we close that study. It's all part of our shared commitment to really advancing research that moves the field and patient care forward. I'm really proud to be part of this EP team, and we are so lucky to have Dr. Woods as our chief EP leading this important, innovative work. Before joining Sutter, I earned my bachelor's degree from NYU and my master's from Northwestern, both in the arts. I later pivoted into healthcare, working as a medical assistant and a 911 EMT in New York City, including during the height of the COVID-19 pandemic. I then moved to California, enrolled in a STEM post-baccalaureate pre-health program at UC Berkeley, and one of my classmates recruited me to join the research team here at Sutter. I've been in clinical research now for just under 2 years, and I look forward to applying to medical school next year. Coming from a non-traditional path, I was eager to explore another side of healthcare, and clinical research offers a window into medical innovation where you see investigators turn questions into evidence and evidence into improved patient care. Dr. Woods often emphasizes that doing these clinical trials isn't about just understanding what does work, but also being able to identify what doesn't. And that process is really integral to driving this innovative work forward. I think clinical research in general is a really meaningful way to contribute to medicine while also staying connected to the real world impact that it has on patients. And I know I speak for my entire team when I say that these interactions with our patients are definitely some of the most rewarding parts of what we do here. A day in the life of a CRC. I think what I love about the coordinator role is that every day is a little bit different. The job definitely requires that you stay really flexible, highly organized, and understand how to triage your most important tasks so that everything gets done. But every day is a little bit different. You could be in EP procedures with Dr. Woods and arrive a little bit early to go check on your patient in pre-op, make sure the sponsor is supported and ready to set up for that case. But I would definitely say one of the most important things we do is definitely checking daily on adverse event reporting. We get notifications when our patients are admitted to the ER, and we are very hyper aware of those notifications to ensure that we are promptly reporting all those adverse events. We also check in, I'd say, pretty consistently to ensure that we're maintaining a lot of strong data integrity and just reporting it timely. So all those queries that you guys issue, we do check on those pretty often. And then you could be completing any series of trainings. You could be completing a protocol training. You could be getting device trained on a Holter or a cardiomobile device, or you could also be getting trained on a new EDC you've never seen before. And so lots of trainings for sure. We do a lot of interfacing with patients. So whether that's introducing a study, going through the consent, outlining clear expectations, providing reminders before, let's say, a follow-up visit, or an overview of what procedure day is going to look like. We do a lot of chatting with our patients to make sure that they have a good idea of what to expect. We believe in really strong patient education here. We tell every patient you are your best advocate and we are here to support you. And by really outlining clear expectations, we've noticed that patients communicate with us a lot better. So if a patient, let's say, really understands protocol and study adherence and what those visits are going to look like and the importance of them, they're a lot more likely to call us if, let's say, they have a conflict or they have to go on vacation. A lot of patients really want to do well in these studies and definitely feel a little bit special having some extra eyes on them. So we really believe in providing clear expectations, and that in turn really provides strong communication. I would also say that our EP team collaborates a lot to ensure that everything's well organized. We meet bi-weekly to review everything: procedures, follow-up visits, any meetings that we might have. We ensure that everything is properly distributed so that we can divide and conquer as a team. The good news is that everybody on our team is cross-trained, so we can step in and help out with any study at any point in time. I would say we work very closely with investigators and mid-level providers and schedulers to ensure that all the baseline assessments and orders are placed for all those follow-up visits, and of course everything also leading up to procedure day. There's a lot of collaboration there. One of the things I do love that our site does is that every time a study is activated, we actually do a really big call with all the mid-level providers, nurses, schedulers, coordinators, and it's a really great opportunity for the PI to outline clear expectations for the study and communicate any important information he wants the team to know. So I have found those calls to be really, really helpful. The role can definitely be fast-paced and keep you on your toes, but I would say it's deeply rewarding. At Sutter, every EP study has a lead coordinator that does most of the day-to-day interfacing with the sponsor and collaborates very closely with the PI to really ensure that the PI's vision is being executed. And that lead coordinator for the study will handle any day-to-day logistics, as well as delegate specific patients to other coordinators as needed. Part of our philosophy at Sutter is that too many hands on one patient leading up to procedures just doesn't really work. We've found it's better to have one specific coordinator responsible for everything from A to Z. So when that investigator sends over that patient, that specific coordinator is responsible for pre-screening and discussing their findings with the investigator, and then the investigator takes a look and either agrees or decides not to move forward, and then you will wait for instructions to obtain consent. And then that specific coordinator is responsible for completing all the baseline assessments to get that patient to procedure. That's one of our processes for getting that patient through enrollment and consent all the way through procedure. I will also say that we are a lot more collaborative on follow-up. We will share the follow-up a little bit more. It can just depend on the weekly needs of the team. We also have something here which we call a proper patient handoff. So if a coordinator, let's say, is going out of town or on PTO, let's say for a week, and they need a little help covering their patient, we will sit down and discuss everything that's happening with that patient or has been happening with that patient. Maybe that specific patient needs a little extra reassurance, or is a little bit nervous leading up to procedure, or isn't as familiar with our hospital site and needs to get a little bit more acquainted with where to go for, let's say, their echo or their EKG, and needs a little more guidance. Those are all things we would discuss at the time of that handoff. And we have really found that it really keeps things smooth for the patient when there are multiple coordinators involved. That has really helped our site to really maintain a really organized system for getting these patients from enrollment to procedure and then follow up to the end of the study. We really enjoyed working with the Kardium team. They always showed up on time, enthusiastic, and worked really well together as a team to execute those procedures with Dr. Woods. There was also clearly attention to detail beyond just the catheter, because you guys developed a really terrific mapping system. I was impressed by that. I would also say that there were thoughtful choices made about third-party vendors like HeartCore. We got a lot of terrific feedback from patients that the devices were super user-friendly, and a lot of patients didn't want to give up their devices at the end of the study. The safety team was also very collaborative regarding those more nuanced AEs that could have been reported a few different ways, and I appreciate the way they approached those discussions with Dr. Woods and my team. Overall, it was a really positive and rewarding experience, and Dr. Woods, my team, and I look forward to supporting Kardium in future endeavors.